Hello, my name is Tess Ellens. I am a public health nurse from Stearns County Public Health. Today we will be talking about sexually transmitted diseases or infections, otherwise known as STDs or STIs. We are going to start out the presentation with a short quiz to assess what you already know. Question number 1, true or false? You can get chlamydia from a toilet seat. The answer is false. Chlamydia is only sexually transmitted. The bacteria that causes it can't live for very long outside of the body, so you can't catch it from an object like a toilet seat or a towel. Question number 2, true or false? It is easy to tell if your partner has an STD. The answer? False. You might notice a rash, sore, redness, or something abnormal, or you may not. Just because there are no visible signs does not mean that you are safe. People can have an STD and have no obvious symptoms. You will not know your partner's status unless they are tested. Question number 3, true or false? STDs are only contagious once you have symptoms. The answer? False. STDs can be contagious even when there are no signs or symptoms. If you are sexually active, it is very important to get tested for STDs, even if you don't have symptoms or if you have symptoms that seem unrelated. Question number 4, true or false? You can get an STD from giving or receiving oral sex. The answer? True. For example, if you're performing oral sex, it is possible to actually get chlamydia or gonorrhea in the throat. If you're receiving oral sex, you can also get genital herpes around your mouth, which can be passed from contact with oral herpes. The best way to avoid STD or STI transmission through oral sex is to use a barrier, such as a condom or a dental dam, between the partner's mouth and the other partner's genitals. Last question, number 5, true or false? Taking a shower or washing yourself after sexual contact will avoid STD transmission. The answer? False. Do not rely on washing yourself after sexual contact to prevent the infection. That does not work. The best way to reduce your risk for STI transmission during sexual contact is to use barrier methods of protection, like condoms, to prevent STI transmission from ever happening. So why does this matter? Why are we talking about STDs with you? More than 2 million cases of the 3 nationally reported STDs, chlamydia, gonorrhea, and syphilis, were reported in the United States in 2016 at their highest number ever. From 2016 to 2017, the chlamydia rate increased by 4%. From 2016 to 2017, the rate of gonorrhea increased by 28%. And from 2016 to 2017, the reported rates of syphilis increased by 10%. So we kind of have an epidemic of STDs, which is why we need to talk about it. This is just another way of looking at those statistics in the United States and how many cases we have for the 3 nationally reported STDs. So what can you do, and what are we going to talk about today? So specific behaviors that reduce the chances of STDs include 1, avoidance of sex or abstinence. We realize that this is not a very realistic option, so we're actually not going to talk about that. Number 2 is a reduction in the frequency of sex. Number 3 is a reduction in the number of sexual partners. Number 4 is correct and consistent use of condoms and or other forms of contraception. And number 5 is early detection and frequent screening of STDs. We are going to focus mainly on 4 and 5 for reducing the chances of STD spread. This is a really nice graphic that talks about if you know your risk. On the left-hand side, this is how many sexual partners you have. On the right-hand side, depending on the number of sexual partners that you have, that is how many people you could have been exposed to. So if you have been had 2 sexual partners, you could have technically been exposed to 3 different people. You can see as that number of sexual partners increases, the number of people that you could have likely been exposed to increases exponentially. If you have had 7 sexual partners and your partner has had the same number of partners of you, you can be exposed to 127 individuals. So it can even go up as high as 1,023 individuals. So they really talk about and mean what they say when they say that you've had sex with every person that your partner has had sex with as well. So the Medical Institute of Sexual Health considers 27 identified diseases as STDs or STIs. We're not going to talk about all of them today. We're just going to talk about the ones that we have highlighted here. First one we are going to talk about is HIV. So everybody knows about HIV and AIDS. So HIV is the human immunodeficiency virus, which is the virus that can cause AIDS. HIV can spread from person to person during vaginal, oral, or anal sex. That will be the same throughout the rest of this presentation, so I'll try not to elaborate too much on how it spreads. HIV can also be spread while sharing needles or reusing equipment to inject drugs, tattoo, or body pierce. In the 80s and 90s, there was a big scare about needing to avoid people with HIV, not wanting to touch people with HIV. That is a myth. So we really want to reiterate that HIV infection cannot be spread by social contacts, such as shaking hands, swimming pools, a social kiss, toilet seats, sharing cups or food, hugging, or coughing. The following bodily fluids have been proven to spread HIV. So blood, semen, vaginal fluid, breast milk, or other bodily fluids containing blood are all able to spread HIV. What happens is that over time, HIV will attack and weaken the immune system, which makes the person who is infected vulnerable to a variety of infections and some cancers. When the immune system has reached this point or reached this stage due to the HIV virus, this stage is called AIDS. When this person is vulnerable to all of these diseases, that is when you get AIDS. So signs and symptoms, early signs and symptoms, which can occur a week to months after the exposure, include a flu-like illness or swollen lymph nodes. Again, very non-specific, which is why it's so important to get tested. If I had some flu-like illness, I probably would not suspect HIV. If it is not taken care of at that point, the later signs and symptoms, which can occur years after the exposure, include persistent fevers, night sweats, diarrhea, unexplained weight loss, purple bumps on the skin or the inside of the mouth and the nose, chronic fatigue, swollen lymph nodes, and recurrent respiratory infections. Again, a lot of these are non-specific and can be a lot of different things, which is why it is so important to get tested. There is no vaccine to prevent HIV infection, nor is there a cure. Once you have the virus in your body, you will have it for life. However, HIV is no longer considered a terminal illness like it was in the past. It is now really looked at as a chronic illness like diabetes due to great advances in treatment that we've had in the past few years. So HIV patients who seek early medical treatment and get started on antiviral medications can live actually very long, healthy lives. What these antiviral medications do is they keep the virus from replicating as well as keeping your immune system healthy. There is actually a new campaign called U=U, which stands for undetectable equals untransmittable. This means that HIV patients who adhere to their antiviral medication treatment can actually have such a low number of HIV virus replication that we cannot detect it in the test that we have. Although somebody with the HIV virus will always have it in their body, if we cannot detect it on a test, this means that they are unable to transmit HIV. So this is really encouraging for people to make sure that they're staying on top of their treatment so that they can live a normal life. The next next one that we are going to talk about is going to be herpes. Herpes is an infection caused by two different but very closely related viruses. So there's herpes simplex 1, which is cold sores, or herpes simplex 2, which are genital herpes. So both are very easy to catch. They have very similar symptoms like blisters or sores, and both can occur on different parts of the body. So kind of throughout time, we've always thought of herpes simplex virus 1 as above the belt herpes and herpes simplex type 2 as below the belt herpes. However, because of the increase in oral sex, we are finding cold sores in the genital area and genital herpes in the oral area. So it's really important to, again, remember that those can be transmitted. It's spread the same way: vaginal, oral, anal sex, infected mother to newborn, but also contact with the infected person's lesions. Something very important to note here is that viral shedding can occur in the absence of blisters. So transmission is still possible when you're not having any blisters. Because of this, most transmission actually occurs in the absence of sores because people are not thinking about it at that point in time. Signs and symptoms. So some people never develop signs or symptoms, or they're too mild to notice. If there are symptoms, they can develop within 2 to 30 days. You will have small, painful, fluid-filled blisters on the genital mouth or the anus. What happens is the blisters progress to open sores that crust over and heal within 1 to 2 weeks. The blisters can actually be hidden inside the vagina, so even if you don't see them, they still may be present. You can experience itching, burning, or tingling on the skin in the area where blisters are about to appear. People with herpes typically know when they're about to have another outbreak. The initial infection can often be accompanied by fever, headache, and swollen lymph nodes. And the blisters will go away, but you will always have the herpes infection in your body. The good thing, if you want to say that about herpes, is that those fluid-filled blisters can be painful. So unlike other STDs where you might not know you have it, people typically know if they have herpes. Again, there is no cure for herpes. It will always remain in your skin. Treatments are available to speed up the healing of genital sores as well as decrease the frequency of the outbreaks. An important note here is that some over-the-counter treatments for cold sores are not effective for genital herpes, so please be mindful of that and get a correct prescription from your provider. Next, we will be talking about the human papillomavirus, or HPV. So HPV is also known as genital warts. This is actually the most common of all the STDs. They anticipate that about 3 in 4 sexually active persons has some form of HPV. So there are more than 100 types of HPV. About 30 of these strains can infect the genital area, such as the vulva, vagina, cervix, rectum, anus, penis, or scrotum. There are a handful of HPV strains that actually cause changes in cells and increase the risk of cervical and other types of cancers. So genital warts spread the same way: vaginal, oral, anal sex. If you've had contact with an infected person's warts, sometimes an infected mother to newborn. And warts or HPV can be spread even if no warts are visible, because sometimes the virus may be present on areas not protected by a condom. Something very important about HPV is that there is a vaccine that is recommended for routine vaccination between 11 or 12 years, but can start as early as age 9. So if you have not been vaccinated yet, and if you're a female between 13 and 26 and a male between 13 and 21, you are still able to become vaccinated. Something that's really important to know about HPV is that it truly is, this vaccine is a cancer-preventing vaccine. We don't have a lot of cancer-preventing vaccines, and there was kind of a scare for a long time saying that vaccinating children so young would kind of discourage them from sexual activity or encourage them for having sexual activity. But if we talk about the HPV vaccine as truly being a cancer-preventing vaccine, hopefully people can start to understand how important it is. So signs and symptoms, most people will have no symptoms, but if there are symptoms, they can develop weeks to months after the exposure or not at all. They will have soft, fleshy lumps near the genital or anus. Unlike herpes, these soft, fleshy lumps are painless, and sometimes you might not even know that you have them. You could have itching or burning around the genitals. Warts can be hidden in the vagina or anus, and again, if you don't feel these like you do with herpes, you might not know they're there. The warts can go away with treatment, but the HPV infection can persist. And in 90% of cases, HPV will actually disappear spontaneously within 2 years after the infection. So there is no cure for genital warts. The virus will remain in your skin for the rest of your life. There are treatments to help remove visible warts, but please note that treatments used for other type of warts, like freezing treatments or plantar's warts, do not work on genital warts and can be very harmful and dangerous. So do not get over-the-counter treatments for warts for your genital warts. Please talk to your doctor and get a correct prescription for that, otherwise you can cause some serious damage. Treatment can decrease the amount of warts you have and make it less transmissible. Next, we are going to talk about some of the hepatitises. So hepatitis, any hepatitis causes disease in the liver. So what happens is the virus will damage the liver over time and can lead to cirrhosis or liver scarring, liver cancer, and ultimately death. So there are several types of hepatitis viruses, but today we are going to focus on hepatitis B, since this one is sexually transmitted, and also touch briefly on hepatitis C, which is transmitted via blood. Hepatitis B transmission occurs through unprotected sex, sharing needles for injecting drugs, body piercings, or tattooing, infected mother to newborn, or sharing personal items that may have blood or bodily fluids on them, such as razors, toothbrushes, nail clippers, or pierced earrings. Something that is very, very important about hepatitis B is that this virus can actually live outside the human body for up to 30 days. Most viruses or bacteria outside of the human body die pretty quickly because they need that human host, but hepatitis B is a very strong virus. So even if there's a small amount of blood on a razor or toothbrush and it's been several weeks, you still can get hepatitis B. Signs and symptoms: fatigue, having a poor appetite, nausea and or vomiting, intermittent fever, stomach pain or pain where your liver is, and for those who don't know where your liver is, it's kind of on the upper right-hand side of your abdomen. If your urine becomes very, very dark, if you have light-colored stools, jaundice, which is yellowing of the eyes and the skin, and these signs and symptoms can occur 45 to 180 days after the exposure. Hepatitis B prevention. So there is a hepatitis B vaccine, which is actually a 3-dose schedule over 6 months. That is the best protection that one can have. This typically is there's a birth dose given right when a person is born, and then it is given within the next 6 months. However, anyone that is sexually active who has not received this series is still recommended to get this vaccine. You can also prevent hepatitis B transmission by using a condom during sex, limiting the number of sex partners, not sharing personal items, again, because the virus can live so long outside of the body. It is very important to not share personal items. We want to vaccinate pregnant women and newborn babies with the vaccine. And if, again, you've had unprotected sex and have not been vaccinated, get tested and get immunized for hepatitis B. Next, we will talk about hepatitis C. So this is a blood-borne virus that people can live with for years without knowing it and without having any symptoms. So it is transmitted through contact with infected blood. If you had received a blood transfusion prior to 1992, they actually did not check for hepatitis C in the blood, and there was a chance that you could have gotten hepatitis C through a blood transfusion before they checked that. You can also get hepatitis C from sharing IV drug needles or syringes or contaminated tattoo needles. If hepatitis C is left untreated, it will actually it can damage the liver, causing cirrhosis, cancer, and even death. Something that blows my mind every time I read it is that each year more people die from hepatitis C than HIV, even though there is a cure for hepatitis C. Today's treatment has about a 95% effective cure rate, but again, most people do not know that they have hepatitis C, which is why they have permanent damage, which can eventually lead to death. Prevention for hepatitis C. So unlike hepatitis B, there is no vaccine for hepatitis C. So make sure that you avoid contact with other people's blood and make sure that you access needle and syringe exchange programs. There is one at the Rural AIDS Action Network located in St. Cloud. So please utilize that so that you're not putting yourself or others at risk. There is also a myth going around that hepatitis C can be contracted from dried blood left on needles. This is untrue unless the person who had the blood on there had hepatitis C. There's no way that dried blood can just manifest hepatitis C. So I just wanted to make that clear. Next, we are going to be talking about chlamydia. So it is the most commonly reported sexually transmitted bacterial infection in Minnesota and in the United States. So again, it can affect the penis, vagina, cervix, anus, and urethra. This is just a way of looking at the Minnesota rates in 2017 for chlamydia by county. So these are not the number of cases, but the rate of cases in your county. So you can kind of look at where you're from if you're kind of unsure where you're at. Right in the middle, you'll see Stearns County, one of the darker ones that has a really high rate of chlamydia. That's where you're at right now in St. Cloud. If you move a little bit to the right and down, those are the Twin Cities in that cluster of dark purple, and then you can see where you're at or where you're from based on the map. So chlamydia spreads same way, vaginal, oral, or anal sex, or infected mother to newborn. If chlamydia is left untreated, it can cause infertility for both men and women. Sometimes only one partner will have symptoms, even though both have the disease, which is why notifying your sexual partners about the results of your test is very important. So chlamydia is actually commonly known as the silent STD because most people have no symptoms, which is why it is running so rampant in Minnesota and the United States at this time. If you do have symptoms, they will develop 7 to 21 days after exposure. For women, some of these symptoms can include abnormal vaginal bleeding or discharge, burning or pain during urination, pain in the lower abdomen or anal discomfort. For men, you can have watery or thin white discharge from the penis, burning or pain during urination, and anal discomfort. Chlamydia is completely curable with antibiotics. However, if you don't get tested and if it is left untreated, chlamydia can lead to permanent scarring and damage to the genitourinary tract. So what happens is it can cause pelvic inflammatory disease, which leads to infertility in both men and women. And what happens is this keeps spreading to your sexual partners. So please get tested. Next, we're going to talk about gonorrhea. Gonorrhea is also known as the clap or the drip. Fun fact for you, it is known as the clap because gonorrhea is associated with a lot of pus and drainage from the penis. And so back in the olden days, they used to try and cure gonorrhea by actually clapping and expelling all of the pus and drainage out of the penis with the hands or with a book. So be grateful we don't have that treatment anymore, but just a fun fact of why it's called the clap. Spread the same way, vaginal, oral, or anal sex, or infected mother to newborn. Again, looking at Minnesota gonorrhea rates by county for 2017, Stearns County is right in the middle, that's St. Cloud. You can look at where you're from based on that. Signs and symptoms of gonorrhea, they can be mild or absent, especially in women. If you do have signs and symptoms, they will begin usually 2 to 7 days after the exposure. For women, signs and symptoms include abnormal vaginal bleeding, discharge or itching, burning or pain during urination or bowel movement, more pain than usual during periods, cramps and pain in the lower abdomen, or anal discomfort, itching or discharge. For men, you will have thick white or yellow discharge or pus from your penis, burning or pain during urination, or a bowel movement, or anal discomfort, itching or discharge. Again, gonorrhea can be totally cured using medication prescribed by a medical provider. If gonorrhea infection persists for a long time without getting cured, there can be permanent damage, which can lead to infertility in both men and women. We're also seeing a growing number of antibiotic-resistant gonorrhea cases, which makes treatment more difficult. So just kind of a PSA to make sure you're taking your antibiotics correctly and the full treatment so that these cases of STDs aren't getting harder and harder to treat. Next, we are going to talk about syphilis. Syphilis is known as the great imitator because there are so many signs and symptoms with syphilis that are so similar to other diseases. A person can have syphilis for a very long time and not know it. Spread by vaginal, oral, anal sex, or infected mother to newborn. Again, 2017 Minnesota primary and secondary syphilis rates by county. Signs and symptoms. The first stage, which is known as primary syphilis, will happen 1 to 12 weeks after the exposure. What will happen is a painless open sore will pop up on the mouth, genitals, or anus. These sores, most people don't even know they have, and because they're painless, people do not think that they're anything significant. Sores can be hidden in the vagina or rectum. They will last 1 to 5 weeks. The sore can go away or will go away, but the syphilis remains in the blood if this is untreated. What will happen then if it is untreated? We'll move into the second stage, which is known as secondary syphilis. Symptoms will show up 6 weeks to 6 months after the sore appears and disappears. What happens is you can get a rash anywhere in your body, some flu-like symptoms, and start to get whitish gray patches on the mouth or lips, wart-like lesions around the genitals, and sometimes hair loss can occur. Again, curable at that stage. If it continues to be uncured after secondary syphilis, you will move into the third stage, which is latent syphilis. So you don't have any sores or rashes in this stage, but syphilis is still in the blood and can start to permanently affect and damage the heart, the brain, and other organs over time. So back in history, they kind of talked about people going crazy from syphilis. That is because it went untreated in primary syphilis, untreated in secondary syphilis, and then they ended up having permanent brain damage because they had reached latent syphilis. So again, syphilis can be cured using medication prescribed by a medical provider, especially in stage 1 and stage 2. We can also cure it in stage 3, though it's a little bit more difficult. These stages can happen for weeks, months, or years. Next, we will be talking about pubic lice. So pubic lice, is also known as crabs, is an infestation of parasites that attach themselves to pubic hair and other coarse hair on the body. So although pubic lice or crabs comes from the same family as like head lice, they're not the same thing, so they're kind of like cousins. Pubic lice can be cured with medicated shampoos and creams. So it is spread by sexual contact. And then something that's different about crabs is that it can be spread through close physical contact, even if it's not sexual necessarily, or infested towels, bedding, and clothing. Just because these little guys can kind of last a long time outside the body as well, you will usually see them moving around on the infested towels, bedding, or clothing. But it can be transmitted that way. However, transmission from a toilet seat is unlikely. So signs and symptoms include severe itching, and sometimes you'll see the lice moving around in the hairy parts of the body. Last, we are going to be talking about trichomoniasis. So it is actually the most common curable STD in young sexually active women. There are an estimated of 5 million new cases in the United States each year in women and men, which makes it more common than chlamydia and gonorrhea. Trichomoniasis can be cured using medication prescribed by a medical provider. For signs and symptoms for women, some women have no symptoms. If they do, it will begin 5 to 28 days after the exposure. So they'll have itching, burning, or pain in the vagina, or they'll have a frothy yellow-green discharge with a pretty foul odor. For men, most men have no symptoms, but you can have mild discharge from penis or pain after urination or ejaculation. So the biggest takeaway from all of this is that STDs are preventable if you have correct and consistent condom use, if you reduce the number of sexual partners you have, if you delay the start of sexual activity, not sharing needles, and making sure that you see a doctor for a checkup at least once a year to receive STD or STI testing, or get STD or STI testing more frequently if you've had no condom use or if the condom breaks, if you find out your partner has an STD, if your partner is having sex with someone else, if you're having any injected drug use, if you have been raped, or if you have any signs and symptoms of an STD. So we want to make sure that we stop this increase in number and spread of STDs by taking 3 steps. So talking openly about STDs with your partners and providers, which is what we're doing today. Testing is so important. It is the only way to know if you have an STD. And making sure you're tested annually. So if you do get an STD, you can kind of narrow down who your partners are and inform them. And then be sure to treat what we can treat. So if you have an STD, work with your provider to get the right medicine, whether it's treated or if it can just help cure some of the symptoms. An important thing is how to put on and take off a male condom correctly. So I think a lot of people think they know how to do it, but don't really know how to do it. So make sure that the penis is erect when you place the condom on, otherwise the fit will be not right. Make sure you pinch air onto the top of the condom, unroll the condom all the way down to the base of the penis, and then after sex, before pulling out, make sure to hold the condom at the base, then pull out, otherwise it will come off and expose parts that could transmit STDs. And then make sure to carefully remove the condom and then throw it away in the trash. So this is a lot of do's and don'ts about the correct way for using a male condom. Big takeaways here are: do not store condoms in your wallet. Heat and friction can damage them and basically make them useless. Don't use oil-based products like baby oil or lotion or petroleum jelly or cooking oil as a lubricant, because those will actually cause the condom to break down and be ineffective. And that sounds dumb, but don't use more than one condom at a time and don't reuse a condom. For reduced cost or free STD testing in St. Cloud, you can reach out to one of these 2 sites. Planned Parenthood has reduced cost STD testing. They can also do a sliding fee based on your income for STD testing. You can also go to the Pregnancy Resource Center, males or females. They have free STD testing. If you are not from this area and would like to know where you can get free or reduced cost STD testing, you can reach out to the Minnesota Family Planning and STD hotline listed here, 1-800-783-2287, and they can tell you where you can get that testing in your area. If you have any questions, please reach out to Stearns County Public Health or talk with your staff there. Thank you very much, and I hope you have a great day.